All right, so that is our introductions. Thanks, y'all, for being here. We can see we're from all different, like Cullowhee and Cashers to Bethel and Crusoe and Baltimore and other parts of the state. And we're all here for one reason, which is to learn about Medicaid expansion and how to ensure that every person and every family has access to the health care that they need. So Hun is going to walk us through what Medicaid expansion is and like all of those details and what the statewide coalition effort to push Medicaid expansion across the finish line is going to look like. But for down home, this fits into our organizing. We have the opportunity to organize locally as well as on a statewide level, right? We can participate on two different levels. And so what I want y'all to be keeping in mind as Hun is going through her presentation is, for one thing we're definitely going to want to do here in Western North Carolina is have some kind of local action that draws attention to and provides information about Medicaid expansion, right? And we've had some really great healthcare actions here in Western North Carolina already. I think about our first stand that we did in the January of 2017 when we had like 250 people standing in front of that courthouse. And I never expected that. And so we have a really strong opportunity for organizing a local action here. And so thinking if you want to be a part of that team to help coordinate that local action and help us figure out what that would look like. The other thing is, as we're talking to elected officials, people who are making decisions about Medicaid expansion, one of the most powerful things that you can bring to a person in power is your truth and your story. And so if you have a powerful story about health care that you're willing to share, that's something else that we can use to build our power around Medicaid expansion. So be thinking about if you have a story that could be used in an op-ed, or if we actually do a visit to a legislature where you share your story verbatim to them. That's another way that we might be able to help. And then the last thing is, and Hun will touch on this a little bit more, but we will be taking a trip to Raleigh for a lobby day where the entire state, the statewide coalition of organizations that is invested in this process is going to be going to Raleigh on the same day to go talk to our legislators specifically about Medicaid expansion. And so that trip is going to take place on February 26th and 27th. We'll leave on the 26th, stay overnight. All expenses will be covered. So food, hotel stay, transportation. But that being said, we're going to need to start getting information from folks who are interested in coming with us on that trip starting now. So if you are interested in coming with us and being a part of that lobby day team, I'm actually going to pass around the sign-in sheet again, and on the back of it, or actually if you want to put a star next to your name on the sign-in sheet if you're interested in doing the Medicaid lobby trip. I just wanted to go ahead and put that on your radar now so you can be thinking about that as she's talking about the other details, okay? Any questions about how locally we might be able to contribute that won't be answered by Hun's presentation? All right. Well, then I think I will go ahead. I'm going to pass around a sign-in sheet. This is a good opportunity if you haven't signed in to do that. And just put a star next to your name if you're interested in traveling to Raleigh with us. This is not committing you. This is if you're interested, right? I'll follow up and we'll give you some more information.
What day of the week is that? What days of the week is that?
We're leaving on a Tuesday and Wednesday. Yeah. All right. And
All right. Okay, great. Okay. Thank y'all so much again for showing up tonight to learn more about Medicaid expansion. This is really, really exciting. There have been people in North Carolina who have been fighting for years to try and see this through, and 2019 is really the best chance that we have. Before I go into that, I was wondering, I'm just going to go through a series of questions. Raise your hand if you or someone you know is uninsured. Raise your hand if you or someone you know needed to go to the hospital but was scared that they wouldn't be able to afford the bill, and so they forwent care. Raise your hand if you had a cup of coffee, a meal in a restaurant, or stepped inside of a building that was made by somebody else. So I'll tell you why I asked that last question. So North Carolina has the 6th highest uninsured population in the entire country. In terms of rates, we have the 10th highest uninsured rate. The states that have the highest uninsured populations are those that didn't expand Medicaid. Medicaid expansion was an option that was allowed under the Affordable Care Act, the ACA, also commonly referred to as Obamacare. There's a lot of parts to the ACA. So one of them, for example, is the creation of the federal marketplace or the exchange where people can go online and just easily compare health insurance coverage plans. A lot of folks know as well that financial assistance or subsidies were also available to folks on the marketplace. The financial assistance was available to people who earn 100 to 400% of the federal poverty line. Medicaid expansion was a key component of the ACA. And what the reason for that being so important was Medicaid is a program that's run jointly by the federal and the state government. And every state's Medicaid program is different, but in general for North Carolina, people who can qualify for our Medicaid program, it's very limited eligibility requirements, criteria. And so Medicaid will cover pregnant women and but only after 3 months after they've had birth. That coverage will fade. Medicaid will be available to folks who are on SSI or to folks with dependent children, but that are earning 43% of the federal poverty line. That's very, very low. What Medicaid expansion would have done is increase the eligibility to 138% of the federal poverty line. So just meaning that more working class folks could qualify for Medicaid coverage under expansion. And it would also allow adults without dependent children to qualify as well. And so that's really important for young folks who just hadn't had kids yet, but were caught in the coverage gap, or older folks who have children who are no longer 18 years old. And as Rebecca and I have been touring the state, we have been meeting so many people who are 62, 63 years old, just waiting to turn 65 so that they can qualify for Medicare. Raise your hand if you have heard of something called the coverage gap. All right, that's really great. For folks who didn't raise their hand, I'll just go over it really quickly. So, like I said, financial assistance is available to people who earn 100% of the federal poverty line, but Medicaid as it is now is only available to people who are at 43% of the federal poverty line. So you have people who are between 43 and 100% that can't get anything. They can't qualify for Medicaid as it is now, but they don't earn enough money to get financial assistance on the marketplace. And the reason that I asked you that last question, if you had been served coffee, if you had eaten in a restaurant, or if you had been inside a building that was constructed, is because the top 9 occupations of people who are in the coverage gap are folks who are working in restaurants, cafes, retail, construction workers, folks who clean, really people who are the backbone of our economy and are oftentimes working in kind of dangerous and accident-prone work environments as well, who aren't being offered employer-sponsored health insurance plans through their job that just are uninsured. So these are the folks who have just fallen into what's called the coverage gap. There is a lot of momentum right now in 2019 to see Medicaid expansion go through and cross the finish line with the legislature. Unfortunately, our North Carolina General Assembly has been rejecting Medicaid expansion year after year after year. And it's really resulted in the state losing billions of dollars of free federal tax money, which everyone in North Carolina pays federal taxes. So our tax dollars are going to places like California or New York to subsidize their Medicaid expansion programs, while we are here with the 6th highest uninsured population. I think that one of the reasons that we are in such a good moment in 2019 to see Medicaid expanded is the 2018 election. Poll after poll after poll showed that healthcare was actually the top issue for Americans, not just in North Carolina, but throughout the country. And this is no surprise, right? Our prescription drug costs are out the roof. The opioid crisis has just reached a level where people keep asking, well, why aren't people going into treatment? Why do people continue to use drugs? Well, if folks are uninsured, it's pretty hard to check yourself into a $25,000 treatment facility. So the Attorney General, I don't know if folks saw, he was here yesterday, and he talked about how expanding Medicaid is one of the most effective responses and solutions that we could take as a state to address some of the issues caused by the opioid crisis. In other states that have expanded Medicaid, West Virginia, Kentucky, those are states that are considered really the heart of what's happening with the opioid crisis. West Virginia saw a huge reduction in people going to the ER for overdoses. Kentucky saw almost 700% increase in people going to get treatment for opioid-related substance use disorders. So, and in North Carolina, we had the 2nd highest overdose increase fatality rate in the country. So, you know, this is not only important just for folks getting health coverage for other things, but just also for the opioid crisis. And then we know that the opioid crisis touches in so many parts of our life as well, not just with healthcare, but the criminal justice system. So many people who are going into jail and prisons for substance use disorder or mental health related issues. Families that are being separated because of incarceration. Prior to working in this position, I used to work in overdose prevention, so I trained literally thousands of people on how to use naloxone and passed out clean, sterile syringes to IV drug users. And you know, the folks that I saw weren't going to the ER just for overdoses, but they were also going for other reasons. I'd see people wait until the very last minute to get help, to get treatment for abscesses that they had that had just gotten so big that they really couldn't wait any longer. And I would really like for this to be interactive, so at any point that y'all have a question or a comment, please just feel free to jump in. It really doesn't have to be the Hun show for like 30 minutes. So,
I think it'd be helpful if
yes.
you could name like the yearly salary of a 43% for poverty level.
Yeah.
Do you know that?
Yeah, so it's really low. That's 43% is just under $8,000. When we're, yes, yeah. The federal poverty line is really, really low. I know that,
I think it's more, I don't think people realize that. So.
yes, and then folks at 138% of the federal poverty line. For a family of 4, that's roughly $33,000, $34,000. So,
At 138.
38 for a family of 4.
That's food stamps. Size 3, 4, isn't it? Or don't they still do 138 for food stamps?
I'm not sure about that.
They do a little bit more than that for certain, well, it's just for families, but certain people can get, I don't know.
Well, that's for family of 4.
I'll add something. So I've been on food stamps for a while. My main source of income is being a restaurant server for years, and I just technically left the restaurant industry just because of physical issues and management issues. And I think maybe last year I topped out at $10,000, which was when I worked my butt off. And so I've been receiving food stamps for a while, and then my last review, now my husband just managed to get a roofing job. It's like $11 an hour, but with the weather he has not been doing 40-hour weeks in months. But on my last review, I reported his income and mine, and I get a letter in the mail stating that we were receiving $196 for food stamps for two of us. They dropped us to $64. $130 drop, and this was because however she was explaining it, which was super confusing, was like we're like $80 from disqualifying ourselves from getting food stamps at all. And I have reviewed, because I've been on food stamps for a while, especially when I was single, and I was told that I might not qualify at all, which totally changes the situation if it's one person on food stamps. And it was really disheartening. I mean, because as a restaurant, as a server, we have basically 6 to 7 months that it's in season for visitors. People spend money, then you've got another 6 months that it's cold. And so the restaurants around here rely on local citizens to help keep them afloat. And unless you're an established restaurant or fast food that people nowadays can afford, you're just not making any money. And I couldn't understand how all this occurred. And so it's really disheartening. I pay my taxes. I do the best that I can on the months that I was working as a server. I did the best that I could and made some money, but man, it doesn't count for anything. And when you're $80, $80 from being disqualified from getting food stamps, what is this? Right. I just picked up actually a job at McDonald's. Honestly, not my ideal place, just because of my skill level, but I have to pay my bills. I have to do something. My husband, until he starts getting 40 hours a week, he's got child support payment, which is exorbitant from past years, but, so we're just not getting any help. And so you wonder. And so then I was told, well, you're at this line, so you can work it's like they want you to work 40 hours to qualify, but if you get too many hours, then you're disqualified, then your money goes down. And so that I just was in shock. And then I called to check my food stamp balance yesterday and got the message that said, that was before I put my card number in, said, if you're supposed to get food stamps in February, you are not going to get them again. They stop, everyone stops immediately, but if you're supposed to get them, you might get them by January the 20th. So basically I was told you're not getting any more food stamps, but if you do, if you're supposed to get them, you might get them by January the 20th. And I was like, so what am I supposed to do now? What do you want? I mean, I can go to the community table and get a box or get some food, but it's just, so I absolutely understand. So being a prior server for the last 13 years I've been here, man, it just makes me really mad. It's like I don't know and I don't qualify for Medicaid. I didn't. I either made too much money or I didn't make enough. It's just all this craziness. And food stamps was the only thing the state of North Carolina did not fight me on. And so now I will not have it, and I don't know what's happening. I don't know if anybody else heard that message too, and I called back again to make sure that the message was stated before I put my account number in. So it's whoever else is, I guess, is getting food stamps is not getting them anymore. And I guess this is because, I don't know, I'm assuming it's because of the government shutdown. I don't really know, but I'm assuming I'm correct on that statement. But man, they will absolutely hit you where it hurts, and it just doesn't seem like it matters to people. And the government, some people anyway. So,
it is because of the government shutdown.
Yeah, I kind of figured, but I mean, if anybody else has that kind of story, man, it is super depressing.
I mean, I just got mine today, and that's got to last you through February. If you ain't going to get anything for February, and you're just out of luck.
You are. I mean, there's nothing that you can do. They absolutely cut that right to the bone.
Just to, oh, sorry, go ahead.
No, I have a patient who's elderly, and she gets $61 a month for food stamps. And so her Social Security check went up by a few dollars, and it decreased her food stamp check.
I was just going to reaffirm what you said about, like, being the service industry before I started officially working with Down Home. That's my entire background is in service and retail. And the year that I filed the highest on my taxes, it was $21,000, and I had been working 3 jobs that year. And my partner had been working for a landscaping company. He was a foreman for a landscaping company, had been working for them for 8 years, 40 hours a week, no benefits, making $11 an hour. And so we were the gap. We did not make enough for him to get any subsidies, but also made too much for him to qualify for Medicaid, and he was a working person whose employer was not providing that insurance for him. And so that's just, I think for here, that's like more common than not.
I think part of the problem is that people don't understand who can and who cannot get Medicaid. If you assume that somebody on disability has Medicaid, and that is not true. You assume somebody 65 or who's retired can get Medicaid, and that is not true. And you assume somebody who is disabled has Medicare, and that is not true. And so a lot of people assume that if you're a single person who's out of work, you can get Medicaid, and that is not true. And so I think part of the problem is that people don't realize who can and cannot get Medicaid. So,
Or you assume that all kids can get insured.
and that's not true. And so Medicaid is an income-based insurance, period. So if it is, you can be a family that earns too much. So now all kids can get it. They just made it extremely complicated when you add health choice into it. So, you know, yeah, health choice. So it's just one of those things that, and people assume that the people who are disabled on Medicaid is like 90% of the people who get Medicaid, and that's not true. You know, most of the people who are on Medicaid are families or children who have Medicaid. So there's a lot of misinformation out there, so people don't realize, and they don't realize how important Medicaid is. They don't realize that people use the emergency rooms and can bankrupt our state by going to the emergency rooms that are not insured. And by expanding Medicaid, that will cover that insurance alone will cover that and will help not only the hospitals and the state, and as well as that individual get the care that they need.
Yes, and I definitely want to touch on that with hospitals, but I saw your hand up.
It is a question, and even beyond receiving Medicaid, we have the issue that Medicaid is not covering everything, right? I'm just looking over nationwide statistics. The price, for instance, of delivery nationwide comes to an average of about $7,000, and for a C-section, it's $10,000. And the story that's coming down the pipeline is that Medicaid is not covering everything, and that might be a factor as to why we're losing so many of our rural labor and delivery units across the country, and especially just over the hill here in Macon County, and also our Blue Ridge unit here that was run by Mission. So I'm wondering if there's anything that you could say at some point about what is it that, in addition of Medicaid expansion, making sure that Medicaid is also effectively covering or putting some caps on expenses of various essential procedures like that.
Whew, we will talk about transformation. We'll talk about managed care. So in addition to Medicaid expansion, there's also something really important that's going to happen to our Medicaid system this year that has a lot of implications, and there is some concern to be worried about what's happening, and it's important for us to be watchdogs. I saw...
How do you see Medicaid transformation hindering this work that we want to do?
That's such a good question. So,
you know, of course, they're trying to make it look good on paper.
Yeah.
And let's just get real about this and what this is really about.
yeah, so for a long time, there were folks in the GOP who kept saying no, no, no to Medicaid expansion because our Medicaid system is going bankrupt. Every year we're in the red. We never know how much it's going to cost. There's so many overruns in the system. And so there were some folks, and in particular Senator Ralph Hayes, who were really championing a change to our Medicaid system, which is right now we're going through Medicaid transformation. So what that means is right now the Medicaid system is fee for service, which means so if you are going to the doctor and they run a blood test on you and then they are doing a mammogram and a pap smear, each of those services are being charged separately. And those get sent in a bill to Medicaid. We're now going into something that's called managed care. And so what's happening now is that DHHS has put out an RFP for companies to bid on being providers of managed care, which means so instead of billing the state fee per service, companies are being paid a set amount, and it's sort of like the idea of sort of a prepaid health plan. So companies are responsible for overseeing the overall health outcomes of the individual. So let's say, for an example, someone has issues related to smoking cessation or something. Like maybe they're having some health issues related to being chronic smoker. That managed care company would most likely refer that person to a tobacco cessation program. Medicaid wouldn't be charged for a tobacco cessation program fee. The company would just be receiving a flat fee, and then if the outcomes of the person are improving, then the company receives a financial incentive for having improved health outcomes. There are some real concerns about Medicaid transformation happening because in some states it's been a nightmare. Some companies, especially ones that are for profit, have denied services to people saying, oh, that's too expensive, you don't really need it, your health is still okay. And there have just been some real concerns about managed care. There are obviously a lot of concerns to have about a for-profit company handling people's health care, I think. What will happen, I think, with expansion is in early February, the state will announce which companies are being awarded the bids to the RFPs. There will be 4 regions for the managed care plans, and we'll find out in February who will be getting those bids. What will be interesting is for the national companies that have been working in managed care for states that have already expanded Medicaid, they have seen how beneficial it is to have Medicaid expansion because that means more people who are insured, which means more customers, and so which also means more money for them. It's really, really icky to think of it that way, but in some ways you could kind of think of them being another champion for Medicaid expansion. Yes. Yes.
It's probably been 15, maybe 20 years ago. They had I don't remember what it was called, but if you were on Medicaid, some people had to have their primary care refer them to a specialist. And of course, that never worked, and the primary care was supposed to be responsible for keeping them out of the emergency room and all that. Is that going to happen again, where if they're with that plan, they have to go through that gate? And I mean, it didn't work before. I don't know why it would work.
And why they would try something that didn't work before.
Are they going to take into account that most people that are going to be on Medicaid may not have a way to get transportation to go to a smoking cessation? Or if they're working, they can't go to a smoking cessation class. I mean, there's so many issues there.
Right. So Medicaid does offer transportation services to folks who are unable to get rides to services. there are some people who have mixed responses about how good the transportation service is, but I heard, did you want to jump in? Okay.
I was
All
going
right.
to say, I've definitely heard from Jackson County officials that the Jackson County Transit, that service is going to entirely be reliant on what happens with the MCOs. So that could, could or may not be an option.
I have not.
Because I'm an MCO. What's happening, I mean, Medicaid is run by our state, guys. Medicaid is run by North Carolina. And so, and mental health and substance use is run by your MCOs. And that's via health is your local MCO. What they're going to do is they're going to hand it over to whoever wins these bids. United Healthcare, Blue Cross Blue Shield, Aetna, whoever, all those private companies that you're used to hearing, those big names, all of those ones are the ones who are putting in those bids. And 4 of them will win those bids, you know, and that's when we'll find out. And those private companies, will decide transportation, they would decide coordination of care, they would decide who gets what and what they will cover and as a Medicaid person, just like they do for that private insurance.
Yes, I love.
I think it's on the topic, but so I've been hearing more on the federally qualified healthcare centers. And so I'm wondering, what have you heard on these? Because I know that there's been a lot of talk about these federally qualified healthcare centers, kind of like Blue Ridge Healthcare Center and things like that, Meridian Behavioral Health. Are you hearing more on the government looking towards those type of centers for overall health care? Because that's what I'm hearing, and I'm actually part of Meridian Behavioral Health Care. I'm on the board of directors. And so all of this is really important to me to hear so that I can understand exactly from your point of view and theirs and what actually would be relevant to the citizens here and what would work.
That's a good question. So the Association of Community Health Centers, which represents the FQHCs, they have partnered with UNC. Do you remember which hospital? I can't. They did partner. I think it's with UNC hospitals, but don't quote me on that one. They did partner with another entity to put in a bid, or to put in a proposal, or to bid for that.
Does it seem like the government might be leaning towards these kind of centers for people, or is it? Might be kind of an odd question. I just know if you had heard. I've heard several things about entities, corporations integrating and them wanting to go that route to help everyone. So again, with transportation, which I've seen from either myself or other people, you don't have to go to 4 different doctors in 4 different places, but transportation, you could go to one place, one center that would manage your health care.
I don't really, it's very unclear who will be awarded the bids. I'm sure there's lots of rumors circulating around, and I don't know what all DHHS will take into consideration with awarding the contracts out. My colleague has been a part of overseeing and being a part of that process with DHHS to make sure that the interest of patients and of North Carolinians are being represented in that process. One thing that I do want to flag for y'all as we're on this topic of transformation is DHHS is actually doing something fairly innovative around something that's called the social determinants of health. It's a really wonky term, but what it really means is thinking about factors such as someone's job, their housing, their neighborhood, their environment, how those factors can influence someone's health. So for an example, is someone in a neighborhood where they are closely located to a grocery store? Are they living in a house that is mold-free? And one of the things that will happen with transformation is there's going to be a pilot program in North Carolina where there will be another bid for organizations to submit proposals to address some of these social determinants of health. So, which makes sense. Like if you have a child who keeps going to the emergency room for asthma-related conditions because he's living in a moldy house and the carpet's bad, why do we keep paying to send him to the hospital when you could just pay to replace this carpet? So it's sort of thinking outside of the box of like just strictly medical care, but all of like the social factors that can affect your health. I saw a hand. Yep.
If I heard you right, if money is the profit's the bottom line, then my company, if I have a company that did one, I can deny you because you're a high risk, and I can get away with it. Did I hear you right on that?
Yeah, so I mean, you could deny me a service.
Because I'm not going to make any money off it.
Or it's just too expensive.
Yeah. And that will be legal.
They are going to be creating what's called, I hate this word consumer, but that's the term that they're using. They'll be creating consumer advisory boards for this process and for what happens with whatever companies are being awarded the bids. And so we will be looking for folks who want to serve on that board, and it'll be really important for people to serve as, to essentially be watchdogs for people who are on Medicaid. It's almost at 2 million people in North Carolina who are under public health insurance program.
So I haven't watched this bill very closely, but Carolina Cares, how do you see that being a hindrance to Medicaid expansion? Do you think it'll get any traction in this upcoming legislative session?
Great question. So, Carolina Cares. All right, Carolina Cares is the North Carolina solution for Medicaid expansion. It was introduced in 2017, and it was the first time that there were members of the Republican Party that introduced a bill to expand Medicaid. It is called Carolina Cares because the term Medicaid expansion is just so toxic and visceral inside of the General Assembly. There are two features of Carolina Cares that I personally find extremely problematic. The first is work requirements. So, yeah. So, requiring people to submit documentation, go online and show that they're working at least 30 hours a week. The truth of the matter is, and we'll be releasing this report very soon, and I can send it to Todd to send out to y'all and Chelsea, is of the roughly 300,000 folks who are in the coverage gap, only 10% are not working. And that's most likely because they have some kind of disability that prevents them from working. Carolina Cares, as it's written now, as it was written in 2017, has very loose language, and it does give a lot of authority to DHHS to oversee how the work requirements would be implemented. There are exemptions in it for people who wouldn't have to do those silly paperwork requirements. For example, folks who do have disabilities, people who are working as caretakers, because that is oftentimes a full-time job for folks. So they have those exemptions, but we would never come out in support of work requirements. There's some research that's been shown when people have to do bureaucratic administrative crap, that's for receiving government assistance or being benefits of a government program, people lose faith in the government and they feel like government doesn't work. And what that also results in is people are less likely to participate in our democracy and to do things like vote or call their representative because they feel like in this small way government isn't working for them. And so just on a larger scale, just sort of in that lens, I'm very concerned about the work requirements and what it could do to the health of our democracy, which I believe is already being threatened in so many other ways. The other part of Carolina Cares that I really don't like is a 2% premium. So making people pay a premium to be on Medicaid. People do not have to do that for regular Medicaid. We're also talking about people who are earning 44% to 130% of the federal poverty line. So you're talking about getting like $50, $25, $100. And administratively, it costs more money to collect that money than what's actually coming into the system. And to verify the work.
Millions of dollars will be lost just in all this paperwork.
Absolutely. Yes.
Then the system to actually provide that service.
Yeah.
Frustrates workers, turnover. I mean, it's kind of a domino effect for this.
Yeah.
Yeah, the 2% premium was kind of laughable.
Yes. And the other thing about the 2% premium that's really problematic is Medicaid is jointly run by the federal and the state government. So who would the money be going to? The feds or the state? Do they get 1% and we get 1%? At the end of the day, we're just talking about pennies that we're collecting, but hundreds of, thousands of dollars that you're having to put in just to pay people to run the system and implement something. With Carolina Cares, the co-sponsors who introduced it in 2017 have all indicated that they want to introduce it again in 2019. There have been folks from the GOP who are actually saying that they're open to the idea of Medicaid expansion. I think that the reason they're saying that is because Republicans, I think they're starting to wake up. 2018 election showed how important healthcare was to Americans. It was predicted that the Republicans would lose their supermajority in the House, but folks were surprised that they lost it in the Senate. And what that means is, for the first time in years, they don't just get their way anymore. Governor Cooper finally has some real power. They can't just overturn a veto from the governor. They're going to actually have to work with him. So this will be interesting. Maybe we'll actually get some more done that's helpful for working class people in North Carolina. The parts of Carolina Care, they're just in there to give members of the GOP political cover. They can say things like, we want people to have skin in the game. You can't just give handouts, for nothing. People have to be working,
Why not?
Those,
Why can't why do we give handout for not? Why not? We're not talking cash. We're talking medical care, and the whole point of Medicaid, of why it was instituted, was to get our country healthy enough for us to send our people into the military so they can fight. Because we found out that our whole country was not well enough to fight. That's why Medicaid was instituted. So why not? They're saying, no, don't give anything for nothing. Why not?
For sure. And when so Rebecca and I have also been meeting small business owners. And they talk about how important it is for their employees, right? Not all small business owners, although they would like to, they can't all afford to provide health insurance plans to their employees because it's super, super expensive. So there are folks who would like to be able to have health insurance coverage for their employees. It means a healthier workforce, which is really important for our economy. It's also another interesting perspective that I hadn't heard before is sometimes people want to start their own business, but are too scared to leave their job because they get health insurance through their employer. And so this, in another way, having Medicaid expansion could actually encourage entrepreneurship and folks to start their own business. Small business owners employ more folks than the corporations. So this is another thing that'd be good for our economy. if North Carolina was to expand Medicaid, we would have 43,000 jobs throughout the state. We'd inject $4 billion into the economy. And I did bring some county level fact sheets for y'all to look at. It's for Jackson. I'm sorry I didn't have one for Haywood. But in Jackson County, 21% of the residents here are uninsured. Mind you, the statewide average is 11%. That is huge. 20% of folks in Jackson County also live in poverty. And closing the coverage gap and expanding Medicaid would create 305 jobs. It'd be over $600,000 in tax revenue. And then there would be $103 million in business activity. And then this last piece is hospitals would save over $17 million from uncompensated care. So since the General Assembly's decision to reject Medicaid expansion, the state has seen 5 rural hospitals close its doors. 5. In rural counties, hospitals are oftentimes the largest employer, hospitals or county government. So you're not just talking about losing access to care, but wiping out livelihoods for folks. Someone asked me a question about rural hospitals, and right. So this is a trend that we're seeing throughout the state, is that rural hospitals are in a very financially vulnerable place right now. Rural areas, for one, have larger rates of uninsured folks, and that's because a lot of times there aren't jobs that people can get health insurance coverage from. There are more folks living in poverty. Folks living in rural areas also have worse health outcomes. And so hospitals are having to really bear the brunt of all of those factors that are coming together. And hospitals, I think, would really like to see Medicaid expanded. One of the interesting things with the sale of Mission is, have y'all been part of the board that's been created to sort of oversee the sale of Mission Hospital?
Any normal person
Oh, right. Sorry, you're right. I forgot about that. No. Right, okay, so that, truth in the booth. Yes. So I've been hearing rumors that one of the things that they might do with the Mission sale, if it happens, is somehow get who's trying to buy Mission? Which HCA. That they would get HCA to lobby for expanding Medicaid in the state if they're able to purchase it as sort of one of the bargaining chips of the sale. Just as a FYI, since y'all live here. I saw.
Yeah, my question is related to that actually. So going along with this perverse incentive of for-profit healthcare providers being the contractors who are going to put in proposals for managed care, are there any examples that you know of healthcare cooperatives or other nonprofit providers who might be in the position to put in bids anytime in the near future?
So that's a great question. I think it really depends on how we define not-for-profit or nonprofit, right? Like, apparently the NFL is a nonprofit organization.
Once you're truly prioritizing.
Right, Duke hospitals. Yeah, Blue Cross Blue Shield is not-for-profit. Yeah, it really depends on how that term is being used. I wish we had something that was truly visionary and innovative in that sense, where we could really have a collective or cooperative. But there isn't anything that's radical or transformative in that type of organization that submitted a bid. And
Let's start one.
yes, let's do it. Yeah.
Did you list out the companies that submitted bids?
Yes.
How many actually submitted?
I think 8. Mm-hmm. Yes.
When will they announce this?
Early February.
It's supposed to be the first week, but
We'll see. Yes. Yes, sir.
How should we as activists position ourselves with the whole HCA buying of Mission, the Mission system over here? because I'm trying to get some clarity as to what will be the strategy. It seems like it's written in stone, but maybe not. Maybe there's something that needs to be putting pressure with the Attorney General in terms of either opposing it or in terms of shaping the board. I'm extremely concerned that the proposed board does not have adequate representation in the rural areas, especially on this, the 6 western counties as well. So is it worthwhile for us to spend energy in that direction, shaping the board and or opposing the sale, or something completely different? That's what I want to know.
I think definitely the board is super important, and trying to make sure that that board can be as representative as possible of people of color, working class folks, folks from rural areas, all of those intersections. And I think that y'all have an ally in the Attorney General. I was just at a meeting right before coming here with some folks in Asheville who have been very active with the proposed mission sale.
Search?
Not search. There were folks from like different organizations, so AAUW, Carolina Jews for Justice, folks who work as navigators, and things like that. And they said that the Attorney General had not had this sale on his radar until a lot of folks started calling him or emailing his office about what was happening in the state. He also said that this is potentially one of the biggest sales that could happen in North Carolina, where you're having a not-for-profit hospital become a for-profit entity. I would say continue the pressure and showing his office that people are engaged and aware of what's going on. Because before people started calling or emailing, it wasn't on his radar. And I think that goes to show a lot of things. One, the power of the people and what can happen when we're collectively taking action. And then 2, folks in power oftentimes don't hear from people like us, and they need to. And when they do, they're pretty surprised that we even had the audacity to pick up the phone and call them. So just really encouraging y'all to continue those, having those channels of communication open.
I don't know if it was the last word, but I did hear something on Blue Ridge Public Radio last night about him not pursuing, or not opposing the sale, to kind of continue on as is, but with some consideration to the board's composition for the Dogwood Alliance. But that was just last night, so I don't know if there was something that happened yesterday or what.
This is the company out of Tennessee that wants to buy Mission, that has like the trend of closing down rural hospitals.
Well, the concern with HCA is that it is an urban region. That's essentially their market and where they are developed. It's extremely unusual for them to come into a primarily rural area and start buying assets here. It's just it just doesn't feel good. But I do not know why it doesn't feel good.
Yeah.
It's very suspicious.
Well, I have a couple of friends that follow this, and they said that, I didn't realize it was HCA, but they said the people who are interested in buying Mission, and I don't know if this is true or not, that this company has a trend of closing down rural hospitals because they're not profitable.
Exactly.
Of course they're not profitable.
Of course they're not profitable.
So that, there was some concern. So it's not only Western North Carolina that is looking at this, that it's, also Eastern North Carolina that are looking at this. And I don't know if that's true with this company, but.
Right, so before, like way back, I used to work as a reporter on health issues, and there's a hospital in Belhaven. I don't know if folks have heard of Belhaven Hospital, Pungo. Belhaven is a teeny tiny, sleepy little town, very rural, way out in eastern North Carolina, facing a lot of similar issues that folks in rural counties in western North Carolina face. And there was a company, Vidant, that had bought the hospital. They also created a board of folks who are not really from Belhaven. I don't know if this sounds familiar. And what they ended up doing was they closed the hospital and they created a urgent care. That is not the same thing as a hospital.
Can you give birth at an urgent care?
No. And in fact, don't you have a good story of someone who was? Oh.
Just to hop on what you were saying about like what it just doesn't feel good. That to validate your suspicious intuition, in the agreement for the sale right now, they have had to write in stipulations, and I don't know the exact stipulations, but that prevent the shutting down of the hospital for a limited amount of time.
10 years now.
10 years.
They moved it from 5 to 10.
So, which for me, my gut reaction to that tells me that that's their intention, is to shut down the hospital, because it's not forbidding the shutdown period, right? It's just forbidding it for like the next 10 years, just long enough for everyone to quiet down about it, forget about it, and then lose access to it. So your intuition is pretty spot on there.
And I don't know if this has to go on the video, but I would really recommend y'all putting as much pressure as you can on the AG's office. He has political aspirations, and I would recommend using that to the extent that you can in trying to pressure him in doing the right thing in overseeing the sale, if it happens or not. But would definitely recommend putting pressure on the AG's office.
Yesterday on the local news, it really sounded like the sale was a done deal.
Mm.
Yeah.
Wow.
I mean, it sounded like he was okay with it, and they had this board coming along.
So maybe if the sale is a done deal, then our job is to put pressure on him to make sure that the sale goes through in a way that is going to secure the future of healthcare for our communities. So if the sale is a done deal, but they're still navigating what the sale will look like, then we have space to make sure that our demands are included in the demands that have to be met if they want to purchase it, right?
So it still makes sense to call his office.
Absolutely.
And because he will be the one holding them accountable, right, after the fact. So making sure that they are upholding their end of the bargain once the sale has gone through. So he needs to know what we're going to be looking for in that accountability too.
Would you tell the rest of that Bellevue story, because I think that's got a happier ending.
Does it?
I know part of the story was that the Republican mayor
Yes.
became really active in advocating against the closure of that. And I know that Reverend Barber of the NAACP, would bring him to the Tomorrow Monday meetings, and he would talk. And I think he took part in a march to Washington.
Yes.
Is that correct? But didn't something good come out of that? Didn't they prevent the closure of that?
No.
No happy ending, unfortunately.
There was no happy ending. I mean,
in fact, it's led to, multiple deaths of people because one of the things there, which I'm sure you all understand, is the transportation issues. So if the closest hospital is an hour away, if you don't have a car, how are you supposed to get there? If you're having a heart attack, how are you supposed to get there? And so one of the saddest things was a family, they went, it had been closed, and their mom died in the parking lot, actually, of that hospital.
Is it still possible that the hospital be reopened?
They knocked it down.
They knocked it
So no.
That's not a very happy ending.
No.
Yeah.
And the urgent care really doesn't cover the types of services. It isn't the hospital. So it's been very, and also economically, their economically distressed area, what business would want to come and open in Bellhaven when the closest medical center is an hour away? So it compounds all these other problems as well. Plus all the people that lost the jobs that were working at the hospitals.
That was actually something that I wanted to touch on too, is the jobs. Can anyone guess what the top 3 employing industries are here in Haywood and in Jackson County? Healthcare, food service, and retail. So if we don't expand Medicaid and our hospital gets sold to a for-profit company, then we will be losing one of our top 3 employing industries, which will be leaving us with 2 of the worst paying industries as our top employing industries.
Speaking of the expansion of Medicaid, is there a proposed bill, the pending bill, in the legislature still that they're kind of filibustering or, the kind of
Yes.
doing still?
So what's going on with that?
I mean, there's not one, then they'll have to introduce one, and that's a whole other story. So, but if there's one still floating out there, that's a better chance of them.
Yes. So for Governor Cooper, Medicaid expansion is his #1 issue and his top priority. The Democrats seem to be aligned on expansion and getting it over the finish line. And in particular, clean Medicaid expansion. So that means no work requirements, no 2% premium. If you, the research shows that if you had a clean Medicaid expansion, we're talking anywhere from 500,000 to over 600,000 people in the state who could benefit from expansion and enroll in the program. If you have something like Carolina Cares, we're talking like 400,000, 300,000 to 400,000 folks who could benefit from expansion. So that's kind of like half of the number.
And then for those that actually might because there's so much paperwork.
Right, yes, people who are getting kicked off because of paperwork requirements. So what will be very important for people who support clean expansion is to talk about why clean expansion is so much better than the dirty expansion. It's less bureaucratic, more people can benefit from it, it will cost less. The state will not have to put in a waiver application to the federal government to implement work requirements or a 2% premium, which could result in just a delay in implementing the program. So all of those reasons for why clean expansion is better. Yes, sir.
So theoretically, couldn't Governor Cooper refuse to pass any legislation at this point now that he doesn't have, now the Republicans don't have a veto-proof majority until they pass Medicaid expansion in the state? I mean, he's got the power to do that.
Yes. So, yes, that's a great question. So what will happen is the Democrats will most likely file a bill for clean Medicaid expansion on January 30th, which is when they go back into session again. We should all be prepared for that, just in keeping an eye out for that. Carolina Cares is most likely going to be introduced early to mid-February. That's the thought. Can't know for sure. What we're not sure of is, will the bills get sent to a committee and die in committee because the leaders of the state, of the Senate and the House don't want to take it out and have it for a floor vote? We don't know. That could happen where bills just get stalled and die in committee. That's a political strategy. So in preparing for that happening potentially, where bills just are stuck in committee, the other pathway to expansion could be through budget negotiations. And so we could get to a point in around June or July, which is really like the heat of budget negotiations, where perhaps Governor Cooper says, I'm not going to pass this budget without having Medicaid expansion language in it. And that might be his power play and his move. The other reason why expansion might go in a budget rather than a separate bill is for some members of the GOP, they might not want to vote on a bill that's about Medicaid expansion. They might want that political cover of expansion being tucked into the budget, and because that will allow them to say, well, I had to pass the budget, the state was relying on so many services and things like that. I couldn't not vote for the budget, right? And so that's just sort of a strategy for providing political cover to Republicans who have been holding out on expansion that we could potentially see.
Okay, I just want to be mindful of time.
right.
It is 5 after, and so I do want to bring us back to our next steps, but I saw Anne's hand is
My question has to do with next steps, which is
Yes.
the
Take us in.
lobbying day coming.
Yes.
And what is it that you want to accomplish in the lobbying day?
Great, thank you. Yes! So Lobby Day is February 27th. We will be having accommodation available for folks who are traveling super far, like y'all, so that y'all can come on the 26th. And Lobby Day, we will have the Secretary of DHHS, Secretary Amanda Cohen, come and speak and be our keynote speaker. She'll talk about Medicaid expansion and Medicaid transformation. And then we'll also have a panel of folks who are in the coverage gap to talk about their experiences. We'll also do sort of just like a legislative role play, like things to do, you know, when you're meeting with your representative. And we'll have folks go over to the General Assembly and meet with the representatives and make a lot of noise. We would like for as many people as possible to show up in Raleigh. We know it's far. We know it's Raleigh. Raleigh's kind of shitty, but it really is. But you know, we would love for y'all to come and show up. You cannot imagine how much of an impression it makes upon your representatives to know that a constituent drove all the way from Haywood, Jackson County to Raleigh just to meet with them. We really want it to be an inclusive North Carolina event. We would love for folks from mountains to sea to show up and support this issue. So that's one thing that we have coming up. Other sort of actions that we would like for folks to take is calling your representative. If you can't make it for Lobby Day because maybe you have work or just something else going on, we're going to be encouraging folks to call the representative on February 27th. And Down Home has a great patch-through system to facilitate that. But just calling your representative to say, hey, we really want to see this go through. And that's something else that's really important. When I was working for the organization that was a key part in legalizing needle exchange, we had done all of the right things, gotten law enforcement on board, gotten a Republican to introduce a bill to allow for the distribution of clean needles. And at the very last moment, this Republican senator got really cold feet and was like, no, I can't do this. This is so controversial. Hand out syringes? No. And what we did was we sent out an action alert to folks on our listserv and asked them to please call that representative and encourage him to introduce the bill. The next day, he called us back and said, please make them stop calling. I'll introduce it. And so just again, like just taking, you know, the 3 minutes that you can to leave a message with your representative is really important, especially when it's coming from so many people.
And if you're introverted, just call after hours and we will listen.
Yes. Yes. And we can have things like scripts as well for folks to, you know, feel a little comfortable too. Other actions that we are encouraging people to do is sort of hold like public town hall or community events like this about the issue. And if you can, invite your representative. They are in their home counties on Monday and, well, Friday through Monday. That's when they're not in session. So those are prime days to invite your representative to come and talk about the issue. And I think it would really mean a lot for their constituents to organize something like that. Another thing, and I had heard Chelsea say this as well, is submitting an op-ed letter to the editor to your local paper. They actually read the local papers and they want to know what people are saying on the opinion page. It is the second most read page after the front page. And then other folks in the community, it's a good way for them to also learn about the issue and stay updated as well. And you know, it's okay if you don't have to write a report, a data report to your local op-ed. And in fact, sometimes it's just the personal stories that are the most effective. But if you need any kind of support around that, I'm sure that myself, Todd, or Chelsea would be more than happy to help provide that kind of support. And other things too is telling your story. So we'll be having a video. Rebecca is documentary filmmaker, and we're traveling the state to interview folks who are in the coverage gap, people who may work with people who are in the coverage gap, whether you're a healthcare provider or just, you know, faith leaders, what have you. Maybe you have a family member who's in the coverage gap, and to just share that story, because at the end of the day, we can throw all of these numbers to representatives, but it's really moving and powerful to be able to put a face to the statistics and show them this is someone in your own backyard. Yes. And you guys have a Valentine's Day action.
Oh, yeah, that's true. Well, we actually haven't organized it yet. So
Okay.
I was going to put a call to action. Basically, I think everyone can find something on this list that you can do that is within your means, no matter how much time or resources you may have. If you don't have your own story to tell, share someone else's that gets shared on Facebook, right? Something like that. So we can all have a role in this. As far as the Valentine's Day action, so I want to pull together a team to do this local action / town hall that you were talking about before Lobby Day. We can do maybe 2 things at once, but we had this internal idea at Down Home to do something on Valentine's Day around Have a Heart and expand Medicaid. And we could even, I know some of y'all are more artsy than I am because I don't have an artsy bone in my body, but we could even make Valentine's and like put visuals into it and basically drop it off at the legislator's office or have a big rally that's like come out, show your heart, come up, show up, and expand Medicaid. So if any, I cannot organize that on my own, so I definitely will need a team of folks. It won't be a lot of time-intensive stuff. Valentine's Day is right around the corner, so we probably have like 2 meetings between now and then to get together, figure out what our goals are, make a plan to get there, and then actually do it. So yeah, and then and that is a good opportunity, one, to talk to our legislators. Here in Jackson County, we're really fortunate to have someone who's pretty aligned with us on Medicaid expansion. Joe Queen is the representative in the House. In Haywood County, we're split in half, and so we have Joe Queen, but our other representative is not aligned with us. Her name is Michelle Presnell. And then we have a state senator who represents both counties, Jim Davis, who is kind of, he's like...
He came out yesterday in support of expansion.
Yes.
With work requirements, though.
With work requirements. Yeah, he's someone that we can potentially move a little. So that being said, it's a good day to pull them out, but it's also a good day to pull more voices in that can share their stories, that can come with us to the Lobby Day, which is why I want to do it before the Lobby Day, because some folks may see us out on the street corner with our giant Valentine's Day hearts or whatever we have, and then say, hey, that's something I really care about and didn't hear about before, right? So to wrap up, like notes for if you want to get involved in these things, I am your ultimate point of contact, so you can blow up my phone. If you are interested in Lobby Day, I'll repeat this again, please make sure you're on the sign-up sheet and there's a star next to your name so that I can follow up with you and get you registered for Lobby Day if you're actually going to commit to it. Starring your name is not committing you. We have to fill out a different form for that. If you're interested in any of these other things, why don't you, before you leave, come up here and just like write your name next to it, or just come tell me what you're interested in. Sound good?
Also, I just wanted to say I'm collecting stories to use in a myriad of ways. Social media squares, I'm making some videos that we're going to show at Lobby Day, at several Lobby Days, and they're going to go on social media. Some just written stories, like a whole lot of different things. So if anyone has a story that they want to share with me, you can email me at rebecca@ncjustice.org. And we can do it anonymously or with a pseudonym if you don't feel comfortable.
How do you spell Rebecca?
Rebecca. We can do it anonymously. Whatever the comfort level of the person that wants to tell the story is how I want to help. If it's something that you want to hone to talk to your legislators up on Lobby Day, I'm happy to talk with you all about that too. So either tell me or tell Chelsea she can pass it on to me, and I would be very appreciative, because we're trying to really do the from mountain to sea and show that across the board people need help. and these folks should help us by expanding Medicaid. Sure.
Thank y'all so much for having me tonight.
So we end our meetings at Down Home by passing around a high five. And this is your opportunity, if you do have a last minute question or something like that, when the high five gets to you, that's your last chance to ask, unless you catch her afterwards, of course. So. It's going to be a week.
Oh, the week.
Let's go.
Do it. Group anyways.
Oh, you did? I'm sorry.
The little one, the little one, the little one.
Boom! All right, thank you. If there's leftover food, take it with you. I don't want it. And don't forget to write your name.
I'm pressing